Today we're going to be doing Foley catheter and straight intermittent catheter insertion. I want to go ahead and do my 12 safety practices. You're going to want to verify the care and order for the patient. You're going to want to remember to wash your hands before and after handling any patient or any supplies. The next thing you're going to do is gather and assemble appropriate supplies for the skill. After you've done that, you're going to review any manufacturer recommendations regarding the use of their supplies. You're then going to knock on your patient's door. You're going to enter and introduce yourself. You're going to verify the patient using 2 patient identifiers, such as name and date of birth. Note the overall condition of the patient. You're going to provide for privacy and explain the procedure to the patient. You're going to lift the bed to a level for good body mechanics. Once you've done that, you're going to don any PPE that is indicated. You're then going to remember that after the skill, we need to lower the bed to low position, raise side rails as needed or indicated in the care plan, place the call system within reach, and then lastly, you're going to remember to report any abnormal findings to the charge nurse immediately. So doing this at home is kind of weird. I have a vagina here made out of Play-Doh. There's all the parts and pieces are in there. So we would want to verify the order for the catheter and make sure it's the correct size and all that good stuff. We already have our patient into like a lithotomy position. She's draped and she's ready to go. I'm gonna go ahead and I'm gonna get my Foley kit. We have a 14 French here, and we're going to assess the package and make sure that it is in one piece, it has good integrity, no damage, and it's within the date, not expired. I'm gonna go ahead and I'm gonna open up the kit if I can. And some people like to use this as their trash can, but I have one right here that I'll be using throughout the skill. Piece of plastic here. All right, we're gonna place our kit in between the patient's legs. The next thing that we're gonna do is only touching 1-inch borders. We're going to open away from us. We're going to open to the side again, and then towards us. Now we have our sterile fill between the patient's legs. The next thing that I'm going to do is I'm going to reach around the sterile field and I'm going to take out my sterile gloves, and I'm going to go around here watching my sterile field, not turning my back. I'm going to place these over here to put on later. And we have our blue absorbent drape here. We can go ahead and take it out, reaching around the sterile field, and we're going to unfold it with 1-inch borders. Be sure not to touch it to anything. Okay. We're going to do our little Olay thing around the patient's leg, around the sterile field, and we're going to want to place it under the patient's bottom. All right, after we've done that, we can reach back in around the sterile field and quickly take out the fenestrated drape. This is to place over the vagina or the penis, whatever you're using, to kind of localize the area, but it would fall off and contaminate the field, so we're not going to use it. We'll go ahead and toss it in the trash. Right, now that we have all that done, I'm going to go ahead and I'm going to go over here, not turning my back on my sterile field, and we're going to don some sterile gloves. I'm going to go ahead and open up our sterile gloves here. We have our right hand and our left hand. Pinching only the outside cuff. I'm going to slide this hand right in, being sure not to contaminate any part of the glove. Now we're going to pinch under the cuff here with these gloves. I'm going to apply it to this hand. All right. now we have sterile gloves. Our hands need to be a shoulder width apart and stay above the waist for the remainder of the skill. So now that I've done this, I'm gonna go back around to my working side here. And we can now touch the sterile field. We have sterile gloves on. I'm gonna go ahead and make the train. We're gonna place our kit closer to the patient. And the next thing that we're going to do is we will reach around the sterile field. We're gonna get our 10 cc's of sterile saline here. This is gonna hook into the hub of the catheter here. And we're gonna have that ready to inflate the balloon. The next thing that I'm gonna do is I'm going to reach in and get my iodine swabs here. I'm gonna go ahead and open those and have them ready to clean the area. Give them a wiggle. I'm gonna place them right here for the time being. All right, the next thing that we're gonna do is we are gonna go ahead and grab our lubricant. I'm gonna open it up. I'm gonna set it there for just a second. Right. Being careful not to let the catheter flop around everywhere. We're gonna remove the plastic on it. All right, now that we have that, we can take the catheter and insert it into the lube. I don't know if I can get it in there. I'm gonna place it right back into here. All right, the next thing that we're gonna do is we're gonna now have a dirty hand or non-dominant, and we're going to clean the vagina and the peri area. And while we're doing that, we're gonna be visualizing the meatus and finding it for insertion of the catheter. So I'm gonna go ahead and say, Mrs. Jones, I'm gonna place my hand on you. It might feel cold, but we're gonna get you cleaned up and ready for the catheter. So you would place your hand, get everything separated. You can see the meatus there. You're gonna take your swabs. And I don't think they gave us enough swabs in the kit, but we'll make it work. All right, the next thing that I'm gonna do is I'm gonna go around and I'm going to clean the labia majora away from me. Then I would toss it, making sure you're not going below waist level. We're gonna go around and we're gonna do the labia majora closest to you. Go back around the field, toss it. Then we're gonna do back around the field, labia minora. Go back out and around, toss it. We're out of swabs. They didn't give us enough, so I'll visualize. We're gonna go around and do labia minora closest to us. Back out of the field, toss it, and then one more time, we'll get another one around the field. We're gonna go down the middle, back out and around, and we're gonna toss it. So we still have our sterile hand here. This is our non-sterile hand, so I'm gonna fix my setup here. There we go. But the next thing that we're gonna do is we're gonna go ahead with our sterile hand, go into the sterile field. We're gonna grab our catheter that's lubricated now. Let's see if we can get that under there. There we go. Pull it up. We're gonna go into the meatus here. We're gonna advance the catheter 3 to 4 inches or until urine flow is coming out. Now that we have a urine return, we're gonna take our non-dominant hand. We're no longer sterile. We're gonna hold it into place. We're gonna take our other hand and we are going to push our 10 cc's of saline to inflate the balloon. We're gonna give it a tug. It's in place. Push it in a little bit so it's not on the bladder wall. All right, after that, we can go ahead and disconnect this syringe. Now our catheter is in place, and the next thing that we're going to do, we have it connected to the bag here. We would take it per facility policy and secure it to the leg, and then we would take our drainage bag here and we would hang it below the level of the bladder on the bed frame and not the bed rail. So I'm gonna set that there and pretend it's hanging on the bed. All right, and now we need to remove the catheter. The doctors put in orders for us to come in and remove the catheter. So the first thing that we're gonna do is gather all the supplies for peri-care and for catheter removal. All this stuff would be gone, of course, because we would have already done the catheter and maybe it's a couple days later, it's time to take it out. So we would come in, we would have all our supplies ready for peri-care and catheter removal. We would have our new sterile 10 cc syringe, and we would have everything to clean the patient up. So we're gonna come in, we're gonna tell the patient, hey, we're gonna remove your catheter, explain the procedure. We're gonna go ahead and we're gonna get the patient in position, and we're going to do peri-care if needed, wash around the catheter. After we've done that, we're gonna go ahead and we're gonna attach this to the hub, and we're gonna wanna get 10 cc's out because we documented upon insertion that we placed 10 cc's. Our 10 cc's is coming out here. We got all 10, so we know we're good to remove. We're gonna have the patient bear down like they did when we were inserting, and then we're gonna quickly and smoothly remove the catheter. And then what we can do is we can roll it up in our glove, and then we would then discard of all supplies used per facility policy. So I'm gonna go ahead and get everything out of the way real quick, and we will change out the part and do our straight cath. Take this off. Is here for the straight cath. And I have our straight cath kit. So we've already done our 12 safety practices for the skill. This is just intermittent straight catheterization in and out. The first thing that we're going to want to do is walk in and introduce ourselves to the patient. We've checked the physician orders for the catheter. We have our kit here. Patient has privacy. We've explained the procedure to them. Our kit's intact, there's no damage to it, and it's within date, so we're good to go there. Our patient's in position, his legs are apart, he's straight, he's ready to go for the skill. So we're gonna go ahead and open up our straight cath kit. For some reason I have the hardest time opening kits. And again, that's in between the patient's legs. Touching only 1 inch borders, we're gonna go ahead and set up our field. First, we're gonna go away from us. Inside. Side. And then towards us. Stretch those corners out. We're touching only 1 inch borders here. Now that we've done that, we can go ahead and reach in very carefully without contaminating anything, and we're going to take out our sterile gloves. Again, I'm going to go without turning my back on my field and place my sterile gloves over here to be put on later. The next thing that we're going to do here is we're going to reach in. We're going to get our drape, touching only our 1 inch border. Our drape ready. We're going to do our little OA again around the patient's leg. I'm going to place it under his bottom. Alright, now that we have that done, I'm going to go ahead and go over here and we're going to don sterile gloves again. catching only our little cuff. Well, our sterile glove broke. In real life, if our sterile glove broke, we would have another pair prepared to go ahead and put it on. Just gonna pretend as though that didn't break. These are very fragile. But in real life, if they broke, we would go ahead and don another pair. Right, we're gonna go ahead and do this. Right, fix now that we're sterile. Above the waist, shoulder length apart. I'm gonna come back over to my working area. I'm gonna go ahead and I'm gonna go in the field. I'm gonna move this closer to the patient. Right, back out of the field. The next thing that I'm gonna do is we have our fenestrated drape here that we're not gonna use because it'll fold over and fall and contaminate everything. Go ahead and toss it. All right. We can go ahead and we can take out our cap to our specimen cup. You're gonna wanna place it with the face up onto your sterile field, just like that. We have our labels. I'm gonna go ahead, I'm gonna get my swab sticks out. We're gonna open them. Those ready. All right, the next thing I'm gonna do is I'm gonna go in. We got our lubricant. We're gonna open it. We're gonna grab our catheter and we're going to insert it into the loop here. All right, now that we have all that done, we're now gonna have a dirty hand. I'm gonna reach around. You're gonna grasp the penis, hold it at a 90-degree angle. You're gonna take your clean hand and you're going to get your swabs ready. The patient's uncircumcised, you're gonna wanna make sure that you have pulled back their foreskin. We're gonna go around here, clean in a circular motion from the meatus out. We can toss. And around the field, toss. Okay, one more time. One more time. Around the field, we're going to toss that. We're now going to have everything here in the field set up. There's our cup. We can also place the catheter in there for urine collection. Right, we're going to take our catheter out of the lube, making sure to keep everything sterile. Okay, we're going to tell the patient to bear down as if they're going to pee, and we're going to insert the catheter 7 to 8 inches or until urine flow is present. At the point which urine flow is present, we can have our specimen cup here ready to catch it. We'll be holding this in place here. It's no longer a sterile technique. We got urine flow, so that's holding in place. We're getting our specimen. We can go ahead and take this out. We're no longer sterile, so I'm going to reach over and set it here. We're going to tell the patient that we're now going to let their bladder drain and empty completely. Once there's no more urine flow, we can go ahead and remove the catheter. Tell the patient to bear down and quickly and smoothly take that out. Okay. We can wrap that up in our glove. And we would discard of all of our supplies per the facility policy. We would also provide peri-care if it's needed after we've done our straight cath on the patient. We would put on another glove. We would empty out that, measure it if it's needed. We would also take our specimen cup over here, and we would put the lid on it, label it, date, time, initials if needed, patient name, and you're going to put it in a biohazard bag to be sent down to the lab. You would also want to make sure that before you leave after peri-care that if they are uncircumcised, the foreskin is back into place. And I believe that gets it. That's all we do for our catheters.